Hello everyone, and welcome back to Psychology on Demand. Really excited today to talk a little bit about my expertise, which is trauma, PTSD specifically, and we're going to be talking about single incident PTSD and how you treat that with trauma-focused CBT. So I'm going to do that as concisely as possible, just go run through all that and show you how you do it. So first of all, this is by no means a manual for you to go do it without a core profession. You have to be trained with this. PTSD is a very serious condition, and if mistreated can cause a lot of issues. So just being really careful there and not coming at it with just any discipline. It has to be evidence-based. So I'm a big believer in science and evidence bases before you go and do something. And the ones that are seen as scientifically effective in the UK are EMDR and trauma-focused CBT and narrative exposure therapy. Basically, it's any approach that really exposes you to it without letting you come in and out and re-traumatizing. Trauma treatment shouldn't take years. Any model that is trying to do it over years is causing dependency. I do not believe in these models. I know they are out there. Do not believe in them. You can't keep the dynamic of therapist and patient or client through several years. That becomes more. We can't disconnect from natural human instincts to bond in friendships and things like that. So this is just a quick kind of note before we get started. Okay, so you want to treat trauma? Well, first of all, we've got to look at formulation. So formulation is so important, and I'm going to have a little link to the Ehlers and Clark one, which is the CBT trauma-focused video. That's how you formulate, is just up here, should be around here. And there are several different approaches. So there's the Foe and Rothbaum approach in CBT, which is purely exposure. So it's less cognitive. It's more, you've just got to keep being there in the moment with the memory, and it'll start to process. We have Ehlers and Clark, which says you've got to be there in the memory, but you've also got to get the moments that are most troublesome and the bits that are most stuck in the mind. So some meaning making and some logic and more cognition in that one. And then there is Shapiro's model and EMDR, which is exposure whilst watching something with your eyes or doing bilateral stimulation either on the body or with the eyes. Okay, so first step in all these different models, but especially in trauma-focused CBT, is formulation and understanding together between client and therapist about what you're going to do and why. So it's the core of everything in CBT. Let's go along. Okay, so first step in therapy, and it's very rare that you have to do a very little stabilization work. Stabilization is basically helping people regulate emotion and stay in this middle ground, this manageable and calm place. I have another video that goes through this in a lot more detail. So I'm going to put that again just up here. So if you want to watch that, it just talks a little bit more about this area of tolerance and how you kind of stay there. Just as a quick overview, basically you have states where you become over or hyper-aroused or hypervigilant. This is where your mind is just too overwhelmed by anxiety. You can't think up here. So right at the top here, you just can't think. It's not a good state to be in. Coming down, more kind of manageable area, can tolerate that. And at the bottom, we've got hyper-arousal, so that's shutting off. That's going into a depressed, numbed state where you feel nothing. Or with people who have had very severe trauma, a dissociative state, when they're just not there. They're not there with the therapist when they start talking about it. They've shut off areas of the brain because they did that to survive when they were children or during extreme incidents. So this is called the window of tolerance. This is where we start to bring in breathing to calm the body down, or re-engaging techniques if they're shutting off. So please do check out my other video just up here, window of tolerance, and that'll explain that in a lot more detail. But today I'm just giving an overview. Okay, so next one. Okay, so now you have to do the exposure. So once you've given someone all the tools to manage outside of the therapy session, in the therapy session, you then need to go and expose to the memory. They need to process all that stuff that isn't processed. There'll be images, smells, tastes, kind of really intrusive and tough to deal with flashbacks. So they have to go there. They have to feel it, the raw emotion. A lot of trauma, a lot of PTSD is stuck raw emotion that wasn't allowed out in any way. So you need to go and process it. And what Ehlers and Clark say, so if you need to refer back to the Formulation video, but what Ehlers and Clark say is that you need to also identify the moments where they get stuck. And the idea here is that you have a belief system and it gets shocked. The world is safe. No, well, actually it's really dangerous. The people are safe. Whoa, no, wait a minute. Someone did something horrific. How does this fit? And what your brain's trying to do is kind of integrate this new information, and it has to be done in some way. So they say you need to focus on the bits that are most stuck, and you need to go over those over and over until your mind has processed it. Now you can do this by writing it down and just writing the most horrific part over and over, or going over it. So you write down everything that happened, first person present tense, and then you go over the bit that's most stuck over and over until it's processed. Or you can get a recorder and you can go over and over it. It's a bit harder. You have to kind of stop, rewind, play again, stop, rewind, play again. So it's a bit tougher. But the most important ingredient in any evidence-based approach is the exposure. You're stuck with that memory, but you're not coming in and out of it. You're not re-traumatizing yourself. You're processing it in a safe environment. And it happens quite quickly. That's why just talking therapies, unfortunately, by themselves don't work. Just counseling doesn't do anything. You need to stay in it, feel safe, and reprocess. I've also just put in about bilateral simulation, which is very similar. That's EMDR. EMDR is making you stay with it, but then getting you to follow something with your eyes or to stimulate both sides of your body, because they found that helps you process that really trauma-focused memory. Okay, so that's reliving, exposure, really important element of any evidence-based approach. Reclaiming life. So this is the bit where if you've done it right and you've processed it, if it's one incident, and if it honestly is just one incident of trauma, it will process really quickly, and then you can start reclaiming life. What did it take away from you? What did the fear stop you doing? And you go back and you slowly start going back into these places. Now, with a lot of trauma that I come across, or kind of PTSD or complex PTSD, unfortunately there are a lot more things in the background, and it's not as simple as you process one memory and everything feels better. But people who are generally okay and then they have a car crash, or they're generally okay and then they have a really horrific loss or bereavement, those kind of people can get really quick out. That helps really fast. That's why I said you don't need years. You need 6 sessions, 7 sessions if you've got one incident. Now, unfortunately, most of it comes with more complexity, more trauma, and this is where you really need a bit more expertise, and you need to be looking at processing several memories in a really safe environment with lots of stabilization work. The difference with treating single incident PTSD and complex PTSD is a lot more groundwork, a lot more processing. I personally like to move slightly towards EMDR if it's complex, because EMDR does it just that little bit faster. When you think about the fact that you might be looking at 10, well, hopefully more like 3-4 memories, you want to be doing it as fast as possible. Whereas when there's one, you can go that little bit slower, because CBT allows someone to tell their story as well, which allows them to share it and go through the journey with someone. Whereas EMDR does allow that a little bit, but it's more about just getting through it. Let's just get it processed, not having that emotional attachment, and then you can move forward. So both really good approaches. This was mostly focused on trauma-focused CBT, and hopefully that's helped you understand a little bit, especially maybe if you want to do this in the future. Maybe you going for treatment for a CBT and trauma and you want to know what's going to happen. So hopefully this will give you a bit of a clue about what's coming, introduce you to that if you want to do it in the future, and just give that really kind of general overview. So hopefully that's helped you a little bit. Please do subscribe if you want to see more videos, and please do check out the other videos I've linked, because those will make this, well, it'll help you understand this a lot better. But yeah, thanks for joining me, and I'll see you in the next video.